Hello, hello, hello. Welcome to Stormy's World. This is Stormy. I think I'm going to talk to you guys tonight about lupus and what it's like to live with lupus, since May is Lupus Awareness Month. I have some really good posts that are on Facebook, on my Facebook page, about what it's like to live with lupus. As you can see, I have my beautiful little butterfly rash tonight. It's really red, even up here, but especially down here. It's really red. You can see that my eyes are dark on the eyelids and kind of like dark under here. That's because sometimes I have very sleepless nights with my lupus, especially when I'm in a lot of pain and I am not on any pain treatment at the time. My world kind of turned upside down back in 2019, right before COVID hit. Right before COVID hit, I was on a lupus treatment that was working for me. It was actually a chemo infusion once a month or every 4 weeks. And I really didn't need that much pain medication, but the pain medication that I had was helping to control the migraines. And I was on Demerol. And as we all know, Demerol was taken off the market at about October, November of 2019, about the same time that my treatments ended for AstraZeneca drug trial study. This drug trial study was a 4-year study, and they requested for us to be on an extension program to keep taking the medication because they were going before the FDA. And we were waiting on that approval when COVID broke out. And of course, we all know that AstraZeneca went to work trying to help do the things for COVID, testing, the vaccinations, and things like that. So our drug trial study extension got put on the back burner. So for the whole of 2020, I was on no medication whatsoever to treat my lupus. And then by the time of the end of 2020, I was having migraines full time every day. Probably started like in September of 2020. And up until recently, I've still had excruciating migraines almost every day of the week. Insomnia, inflammation, pain, fatigue, as you can see, thinning of the hair, thinning of your teeth, to where they just break in pieces. Thinning of the nails too. I've been very fortunate. These are my own nails. As you can see, they are my nails. They're not extensions. But these have taken me a year of babying my fingers, going to a nail spa about every 3 weeks to get this layer taken off and dipped coloring put back on, and then a shellac or a gel nail put back over, just the coating. But these are, like I said, my real nails, as you can all see. I used to have beautiful hair, I used to have beautiful teeth, and I used to have beautiful nails. Until I got sick back in probably 2000. I got really, really sick. I had been through a lot between 1998 and 2000. I had a major move from Washington State back to Texas. I was fixing to open up my craft shop in Belton, Texas again, when my house and everything in it burned down, including my supplies for my craft shop. Decades and decades of craft magazines, crochet patterns, cross-stitch patterns, knitting patterns, plastic canvas patterns, and all kinds of instruction books on doing resin and doing bridal bouquets and bridal hats, doing all kinds of different crafts I had in my shop. Not to mention my whole collection of DMC floss in the DMC boxes, all of my yarns, a lot of my hooks and stuff burnt up. I had mill heel beads, I had satin ribbons, I had all the expensive cross-stitch fabrics and materials for my shop. I had all kinds of things. I mean, thousands and thousands and thousands of dollars of inventory went up in smoke and soot. Not to mention some very special projects that I had worked on. One was for my ex-mother-in-law. It was a mama and 2 baby squirrels in a tree. That was her favorite thing in New York on Long Island, trees full of squirrels. So I had made that mama and baby squirrels for her. I had a carousel horse that I had made for my oldest daughter, and that burnt up on the wall. I had many smaller projects that I had done. I had baby dresses, baby blankets that I had made to sell in my shop that burned. I had bolo ties. I had belt buckles. I had all kinds of painting stuff that burned in my shop. So I lost a lot. Not to mention the fact that I lost things that I had collected over the years from my parents. My father was still alive at the time, but my mom had deceased. And I had her quilt patterns. I had quilting things that I had accumulated over the years as well. My quilting frames burned. The ones that I had that hung from the ceiling for me to quilt in. All of those things I lost. But I think the most tragic thing that I lost was my son's eyesight. He was in the house when it caught on fire with my cousin, and him and Ruth made it out with their lives, thankfully, but my son's retina detached nasally in his left eye. So therefore, about maybe 6 months later, something hit him in that eye and it completely detached, and he lost all of his vision at 15 years of age. He was epileptic, under control at the time, but once he lost his vision, he started having uncontrollable seizures again. So our lives went through a very stressful adjustment. Then I met my husband that I have now, and he was a very big support. Me being a single mom with 2 teenage kids, one of which was completely blind just recently, and a teenage daughter that felt like we gave him the world when we didn't. But we survived everything that we went through. Christopher got really, really sick in 2001. He went through some pretty hard hospitalizations. He was in the hospital for seizures and uncontrollable epileptic attacks whenever the trade towers were attacked in 2001. Shortly after that, my husband took me on a vacation in 2002 in July, and we went and spent 5 beautiful days in the mountains of Washington State, and we got to go to the Pike's Place Market in Seattle, which was one of my favorite places. We got to spend a lot of time in the Olympic Mountains, where I used to live at, and spend a lot of my time outdoors. During that time, I had come home by the airport and picked up our car, and I brought him back to our house, and I went to work. Whenever I got to work, my feet were so swollen that I put on a pair of slippers, and by noon, the slippers were cutting into my feet, So I took those off and was walking around in my office barefooted, working barefooted. By the time I got ready to go out in my car that evening to go home from work, I couldn't put the slippers on to get back in my car to drive home. So I drove home barefooted. I went to bed. I got up the next morning and I couldn't get out of bed. So I called in from work, and my husband took me to the doctor, and the doctor took one look at me and asked me, when were you diagnosed with lupus? And I just looked at her kind of puzzled, and I'm like, what? She goes, yes, what year or what age were you diagnosed with lupus? And I just kind of looked at her funny, and I asked her, are you trying to tell me I have lupus? And she goes, yeah. Nobody's ever told you that before? And I said, no. So that was my lupus journey, where it began. She sent me to my doctor, Dr. Phillip. That's his first name. And he was a lifesaver because he's kept me alive for the last 20 years. So I'm very grateful to him because he has taken it beyond what some doctors needed to do in order to make sure I was taken care of when I didn't have insurance. Because I lost my job that same year. I lost my job in 2002. It wasn't easy at all. And I'm lying. I lost my job in 2003 after my daddy died. My dad died in 2003 in June. And I lost my job in October of 2003. So all of those things combined are stress causers that makes your lupus react bad. So my lupus got worse, and in 2005 I had a major stroke, the first major stroke I'd ever had, and it was caused from a little bitty teeny tiny blood clot getting caught in the capillaries back here in my brain, and it completely stopped the blood flow in my body. So I was very close to death. And then after that, I came back home from Alabama, where it happened at, and my doctor made for sure that I got the treatments that I needed. And so lupus has been hard. It's been very, very hard on me. My first stroke left me with right-sided weakness because I had right-sided paralysis upon the impact of my stroke. It lasted for several days, and then they got me the clot-busting medicine worked, and it reversed my most of my symptoms. I still came home with extreme weakness on my right side, and I had to relearn how to pick things up. I was right-handed, so I had to relearn how to write and how to do all kinds of stuff with my right hand. I didn't realize that I had forgotten how to cook, how to crochet, how to knit, and all the things that I love to do until I tried to do some of those things. And it was a real life changer for me. I was scared to do anything after that. It took me several months to be able to not be afraid of being home by myself. And I took on raising 2 children. Less than a month after my stroke. And I do not regret it. Here it is 17 years later, and I tease them that we're all 17 years old. Them and me. I love them very much, and they mean the world to me, my babies do. And you guys will see both of them in my videos. My Destiny and my Dustin of the world, for me and Marco. Sometimes they don't realize it, but they are. This last couple of weeks has been a roller coaster for me because I've been trying to use a new primary care physician who has mistakenly misworded the request for the diagnostic testing that she was wanting to do for me. Therefore, it didn't get done. She sent me to a spine and neck doctor to help me get imaging of my spine and my neck. And I went to see him yesterday. He was a very nice doctor, Dr. Jana. And Dr. Jana sent me down to get a lower spine and hips x-rays. So I got those and I went back to see him, and that's whenever his nurse told me that he was actually not a neck and spine doctor. He was actually a hip and knee replacement orthopedic surgeon. So I was thinking, well, do I leave or do I stay here? You know, what am I doing? I've already paid the copay. So I might as well talk to him and see what he says about my hips at least, right? So he came back and he was telling me that he really didn't know how much he could help me, but that he would see what he could do for me as far as my hips and my spine goes. So he got on there and he told me that I have like an arthritic compression on my L1 disc. And that could be causing some of the problems with my legs. That could be causing my legs to get weak and me to fall, because I've fallen quite a bit lately. He told me that as far as my hips go, I will never need a hip replacement. That was good news, right? But he asked me about the pain on my sides of my hips, if I had trouble laying on my sides whenever I try to sleep at night. And I told him, yeah, that for about the last 6 months or so, I've had a lot of trouble trying to sleep on my sides, and it's very painful. So he told me, he says, well, I can tell you what that is. That's arthritis causing you to have bursitis in those hip joints. So he said, what I can do is I can put in a corticosteroid shot in that joint and get some relief on the inflammation to maybe let you have enough time for that to go down and that pain to go away for you so you can sleep better. And so he did that for me. He put 2 injections in my hips yesterday, 1 on each side. And man, when the lidocaine wore off, it was really painful on both sides. So I didn't get any sleep last night. I slept maybe an hour sitting up on the sofa from 6 to 7. I got back up and then I went to go lay down in my bed, and I slept from probably 5 minutes till 8 until 9 o'clock. So I only had less than 2 hours sleep. Like I said, I'm talking to you guys very openly about lupus, because that's what my main problem is. Along with the lupus, I have got the diagnostics of fibromyalgia, chronic fatigue syndrome, I have GERD, I have a hiatal hernia, I have restless leg syndrome, I have chronic fatigue syndrome, I have, I don't know if I mentioned fibromyalgia, and then I have arthritis. Along with a lot of other things that are going on right now. I was in a car wreck in 1999 with my husband and my kids, and I have herniated discs in my cervical portion of my spine and in my lumbar portion of my spine. So that's why I was trying to get the spine and neck orthopedic doctor to look at me, and the doctor sent me to the wrong place. So we're going to go back to square one and go back and see her again next week, hopefully, and try to get her to correct my patient record where she messed up really big time in the notes, and get her to fix that, and then see if she can fix me getting the needed CT scans that I need to find out what's going on with my neck and my back, because I'm in so much pain that it's hard for me to concentrate on my work. It's hard for me to concentrate on doing housework or anything else. I have been working during this tax season, and it's been really hard and difficult for me. But I know that if I can just hang in there, I'll get this all taken care of and get to feeling better. I want to thank everybody for watching my videos, me and the kids and our magnet fishing, our resin work, our crochet, everything that we've done. This last week I've been practicing on my new iPad with the Canva design to get my videos edited and put together better. I've also got a GoPro that I'm practicing with that I need to figure out how to fix it to where I can do videos and put them on my YouTube as well with that. So you're going to be getting some more videos about my garden, because that's really an important project for me this year, is to get my flowers planted for my hummingbirds and the bees and the butterflies. So that's what my family and I are working on this week in the evenings. I guess that's really all I have to say, guys. I know that if you know anyone with lupus, no two cases of lupus are alike. Everybody is different. Their symptoms are different. The things that they go through are different. Not all patients with lupus lose their hair. Not all of them get so swollen that they can't lose weight. A lot of them, on the other hand, lose too much weight. A lot of them get scars because of the rashes that they get. I've had some scarring and some rashes on my back and on my arms from time to time, but the butterfly, the really red rash right here, is the main one that I get, especially when I'm feeling like I do today. I'm really tired and feel achy all over, just really not feeling good. My voice gets affected, and I don't know if it's more the lupus or if it's my fibromyalgia that causes my vocal cords to feel like they're tearing and hurting when I try to talk. My lungs are affected. Like I said earlier, I have a hiatal hernia. My stomach has been affected by my lupus because I have vomited so much in the years that I have an extremely large hiatal hernia. More of my stomach is above my diaphragm than it is below my diaphragm. No doctor has even thought about touching it for surgery or anything else. They all say, we'll go on a diet, control what you eat, and then we'll recheck it. And I don't eat that much. I try to watch what I eat. I try to eat healthy. Sometimes I go on a binge where all I can eat is ice cream, because ice cream doesn't hurt to throw up as bad as big chunks of food that you're trying to eat and coming back up. So that is my story in a nutshell. I would prefer to be healthier from my lupus. As far as my blood work goes, guys, I only have a 223 for my cholesterol, which the doctor says I need to control by diet or I'm going to be put on cholesterol medication in 3 months. My good cholesterol is really great, though, the one that keeps your heart healthy, so I don't have to worry about that. Hopefully I can change my diet and get my number back down on its own. I'm praying. But it's hard to exercise to where I can keep it down if I'm in so much pain all the time that it hurts to move. I'm trying to think of what else I was going to try to tell you guys about this. Like I said, Lupus Awareness Month is in May. And that's why I'm trying to do this video tonight, trying to bring some kind of light on this subject, because a lot of people don't know anything about lupus. And lupus is an autoimmune disease where your body makes too many anti-nuclear antibodies. These antibodies don't know what to attack because you're not usually sick. And if you're not sick, what are your antibodies going to attack? So it goes into attack mode on all of your normal, good, healthy tissue and organs. So therefore, I have what they call systemic lupus erythematosus. And that is just overall body organ affected lupus. I am very fortunate that the lupus has not affected my kidneys yet. I've got that one plus going for me. It's affected my thyroid. I get nodules on my thyroid. My thyroid, of course, my metabolism has completely shut down. And no matter how hard I try to kick it into activity, I'm still not losing weight. I'm trying to think, guys. I'm sorry. I'm tired. And we get this brain fog sometimes that just stops us in our tracks with whatever we're trying to think and say. So you guys forgive me if that's happening. I really appreciate my family and friends and subscribers, because without you guys, I'm not able to do these videos and get them put out for encouragement and helping people to know that you can live with these illnesses and you can live with these diseases and try to enjoy your life. That's the most important thing. I had the doctor that diagnosed me with fibromyalgia back in 1997 that told me that I looked like the kind of woman that would not just give up. He said there's two kinds of patients in this world. One, you give a diagnosis like fibromyalgia or something like this, or lupus, and they go crawl in their bed and they let their disease kill them. He said, and then the other hand, you have the people like you, who I just told you have this horrible disease, and you asked me what can I do to control it instead of controlling me. So he put me through some physical therapy and some massage therapy for about 3 months, and I ended up getting into remission. And like I said, that was from 1997 to 2002 when I came out of remission. And when I came out of remission, that time it was hard. It was very hard on me. But I know now that I'm nowhere near being in remission, because my lupus and my fibromyalgia, my arthritis and everything is flaring up all at the same time. And I have no pain management appointment until the 16th. So we're going to go to the pain management doctor and we're going to see what he can do for me to get me some help. The orthopedic surgeon did tell me yesterday that that doctor will be the one that can order the x-rays on my spine and find out where he needs to try to do some steroid shots to give me some relief. So that's the next thing. We'll go see him on the 16th. So if you have any questions about lupus, please put the comments in the comments below the video and I will get back to you. You can always email me, comment on there, ask me any questions, and I can try to help you. I also am an advocate for awareness of lupus through accurate clinical research. They've asked me to be an advocate for them, and so that's what I try to do. I am a member of the lupus, of the American Lupus Foundation group, and I advocate for lupus awareness. I also advocate for cancer awareness, breast cancer awareness, cystic fibrosis awareness, and many other things. Epilepsy awareness, because I've had family members that were actually physically attacked by those different diseases. I have a cousin that was born with cystic fibrosis, who I love very, very much. His name is Jerry, and he has been very blessed to have gotten double lung and a kidney transplant and a pancreas transplant, I think. So he's doing a lot better now than he was back a couple years ago. So Jerry has had a rough life, and I've always kept him in my prayers and thoughts. And he's younger than me, of course. So I was like preteen when he was born. So he's always been a very special person in my life. My mom died of hereditary lung cancer, and her mother died of the same kind of cancer. My grandmother didn't smoke. My mother smoked. But this was a small cell oat cell cancer in the lungs. And they both died when they were 47 years old. So I can gratefully thank Jehovah God that I have outlived both of them, and I am able to still be here a decade later. So I really do cancer awareness. I have friends who have had cancer in the pancreas. I have friends who have got cancer that have had breast cancer. I have had aunts and a grandmother that died of stomach cancer. So I have a brother-in-law that has had thyroid cancer and small tumors in his lungs. He's stage 4, but he has managed to live like that for 10 years already. So I keep him in my daily thoughts and prayers, as well as my sister, my baby sister. We have had a lot going on since COVID broke out, because I cannot get the vaccinations due to my health problems. So I've basically been in house shelter, shelter in place. I only go to the grocery store when I need to get groceries, or go to Walmart when I need to pick up supplies. But if I can, I do curbside, and if not, I go in with my masks. I go in, I get what I need, and I get back out. I have not gone to any family function or seen any of my family in over 2 years. The last time I saw my baby sister was in May of 2019. I have not seen any of the other family at all since before that. So I have basically been here with just my immediate household family, and every once in a while my mother-in-law and father-in-law, we've been to go and check on them. So other than that, we haven't had any real visitors. I run my office from outside on my deck instead of allowing anybody in my home or in my office. And the reason I do that is because it's going to be a lot safer for me outside, even in the cold or the heat, than it is for me to let somebody in my office that might have COVID that will kill me. So it has been what it is. I've lost some clients, and I can understand that. My babies and I have started doing the crafting and the magnet fishing, trying to keep us active, trying to keep us busy, trying to keep us outdoors once in a while, doing things in a non-crowded environment, because I cannot do the crowds anymore. We have really tried very hard to stay as positive as possible. I think that the main thing that has helped us to stay as positive during this bad episode of my health has been our spiritual studies, our spiritual activities. We are not allowed to go out preaching door to door like we did before the COVID. We weren't allowed to meet in our kingdom halls until the memorial event in April. And so our kingdom hall has reopened, but I haven't been able to go yet. I really miss being with my congregation and my spiritual family. But I don't want to take too many risks and too many chances with my health right now until I feel better and the doctors can get me somewhat under control. That explains the absence of some of my videos, that I have not been able to video as much as I wanted to and post as much as I wanted to. But like I said, I want to thank you for my 30 subscribers that have held in there and stayed in there for me. And please like, comment, and share my videos. Get me some more supporters on here so that maybe I can touch people's lives, bring them some encouragement, show them how they can endure a diagnosis like mine, or like cancer, or like cystic fibrosis or epilepsy or things that I've lived with my whole entire life. So please, that's not saying that those particular diseases are worse than anybody else's diseases, because I am very, very adamant about mental health issues. I have had a couple of family members that have died from suicide because their mental health problems did not allow them to find a way out. That really brought sadness to my heart. There is a lot that we need to really be able to talk about as a society, and helping people to get through their problems, whether it be a disease, whether it be aging, whether it be an injury or an accident or a car wreck that has put them out of commission. People need to know that there is always something beyond. You just have to hunt for it. You have to find that happy place for you, learning how to cope with what you've been dealt with, learning how to endure what you're going through and get through it. Because I have had 4 major strokes. One caused me to have right-sided paralysis. One caused my heart to stop and be cold blue in the hospital. Thankfully, I was in the hospital when it happened. I have had 50-something days where I had no strength in my body whatsoever to be able to get out of my bed by myself, to feed myself. And one of my son's care providers, Miss Helen, took care of me when she didn't have to. She made for sure that I had meals. She made for sure that my son was taken care of so that I didn't have to worry about him. So Helen has a very special place in my heart forever. She has got some things that she's been dealing with her husband, with Alzheimer's. And she's really been going through a hard time too. So I keep her in my prayers. Everybody has something that they are dealing with. So we need to do our part to put ourselves in other people's shoes sometimes. If they're grumpy, if they're angry, if they're fussy, if they're fighting, maybe it's because they've been dealt a really hard blow to live with, and they don't know how they're going to get through it, because maybe they're alone. Maybe their spouse isn't as understanding and supportive as mine is. Or their kids. Their kids don't understand what they're going through. And like mine are great kids. My kids take care of me. And I appreciate them so much. Sometimes we just need to let other people know we care. Whether it's with a smile, or whether it's with the, hope you have a great day, I hope you feel better, I'm sorry that you seem to have a lot on your plate, a lot on your mind, I hope you have a better day. Let people know we care, because that's what's going to help people get through what they're going through. I didn't mean to cry, I didn't mean to come to tears, but this is something that I am very, very adamant about. People need people. We were created that way. Jehovah put that longing in our hearts to be loved and to be cared for and to be hugged and told, hey, it's okay. You're having a bad day today, but tomorrow's going to be better. Just remember every day to wake up and try to do one thing that can bring you joy every day. For some people, it might be cooking a small meal. For some people, it might be cooking a big meal. For some people, it might be crocheting something, or cross-stitching, or knitting, or coloring, or making a garden. Because those are the things that I missed these last 2 decades. I've been so sick. And this year and last year, I have brought some of those things back in my life. I've taught my kids how to do resin crafts. I've taught my kids how to do embroidery, crochet, cross stitch. Teaching them how to cook, teaching them how to make gardens, teaching them how to can vegetables and fruits. It's going to be next. We're going to have a very busy summer. And letting them do their things. My baby girl takes skating classes, and my son wanted to do the magnet fishing. So I wasn't going to let him do it by himself. So I got me a magnet too, and I go out there with him as often as I can. I don't skate. I'm not going to get on skates. The first time I was on skates, I broke my tailbone. I'm not going on skates. She can skate by herself. But I support her skating lessons. But I've taught both of them how to do different things. I have supported my son wanting to learn how to solder, learn how to use a Dremel, learn how to do things like that. I've helped him, and if I couldn't help him, then I've let him use the iPad to watch YouTube videos on how to learn how to do things. Like I said, I've taught my daughter how to do so many different crafts this last year, and she's actually learning how to support herself by doing her crafts, so that's really good. She wanted chickens, so I allowed her to buy chickens. We built a very expensive chicken coop, and she has 21 little hens, and she's got 2 little roosters, and they lay eggs, and we have 5 or 6 different clients that we sell the eggs to every week, and that buys their food. So as long as that buys their food, we're going to keep using that. And we've planted 4 banana plants. We have guava. We have a fig tree. We have several papaya trees. We have a mango tree. We have avocado trees. So we have all those things. And then I got blueberry, blackberry, raspberry, strawberries, apple tree I want to plant. We had a grapefruit tree. I've got lemons and oranges seeds that I want to plant. We're going to plant a vegetable garden, and we're going to see what we can do about trying to teach them how to survive in this old world when it's getting harder and harder each week to make a living and be able to support your family. So we're going to see what we can do about keeping our family afloat the best we can. I've always been about paying it forward, and I love to pay it forward. I have made things and given it away to cancer patients, to epilepsy patients, to mental health patients. I've given things to people just to make them feel better. And I have taught my kids how to do that. So some of the canning that we're going to do is going to be given to some of the elderly people in our congregation, and what they want to sell to clients, they can sell to clients and help feed us and our family and my in-laws too. So that's my goals, guys. I'm going to try to be here for everybody and do a couple of posts a week on my goals and how I'm meeting them. Give you guys some updates on my health as I'm seeing these new doctors and finding out what's wrong with me and how I can get treated. My hard thing is that my rheumatologist got a letter from the insurance company, and the insurance company is going to drop him because he does not have admitting privileges to the hospital and the HCA hospital where they support. He was on my in-network, but now he's not as of July. He's no longer going to be in the network. So I have to try to find a new rheumatologist or go pay him out of pocket to continue to see me. But they won't pay for him to give me the drug that I need, which is the infusions that was working. And that's what he was getting into place this month. So I don't know if I'm going to be able to take my medications or not like I wanted to get better. We'll see. We'll see what I can do about trying to find a new in-network rheumatologist. And if not, just go to the hospital and put myself in the hospital, and maybe he can come see me at the hospital, and they'll pay for the hospital visit. We'll see. We'll see what happens. Until then, try to, like I said, tell your people that you love them, because tomorrow's not guaranteed to any of us. Tell your children that you love them and that you're proud of them. And tell your husband or your wife that you love them, because life is too short to go one day without telling the people you love that you love them. Stay kind to each other. Stay positive. And I will cut this video short now and say goodnight, and I will be back in a day or two. Bye-bye, everybody, and thank you for listening.